say there's 5 different companies that are providing insurance?
The last I heard, there's some exchanges that have 15 different companies. There's some, in some states, only have 2. I mean, here, what I've heard, and we can hardly wait until October 1st, frankly, to go on the website ourselves with you and see, really who's on, what are they really charging. So a lot of this is speculation. And even when you talk about projected costs, these were studies done by the Kaiser Health Foundation and others, and insurance companies in Ohio were willing to tell them what they're going to charge. So a lot of companies in Louisiana are not transparent yet. They're not saying. So we've understood that they're fine.
So, and again, one of the questions that came up, if there's no pre-existing, and they can't hold you to any kind of pre-existing, then these 5 companies possibly could have tiered insurance, like no?
Absolutely not.
Wow. Good.
You may have noticed that the insurance companies actually lobbied aggressively against the Affordable Care Act.
Is it because all of a sudden they're being regulated?
They're being regulated. This is all private insurance on steroids once you really look at it, but they have some risk. They're not able to just willy-nilly change their rates. They're not able to willy-nilly exclude people. They're not able to willy-nilly do whatever. And yeah, there are some risks because we don't know how many people are going to apply and how healthy they are. They don't know. And they would have liked to have had tiered coverage, just like you're saying, they just can't.
So with this, is there going to be an enrollment period kind of like what has been in the past, is that you had to have insurance to get insurance, or you had to be covered a certain amount of time to be able to be covered, particularly with pre-existing? Really?
October 1st, mark it on your calendar, put it in your smartphone than you are, and have it beat you, because come October 1st, you need to get into this pool between then and December 15th, so you've got insurance, you've paid your first premium, and you are set for January 1st. Yes, sir.
So by getting into this pool, I happen to fall into this situation I've covered through my wife's employer. So I don't need to get into this thing, correct?
You're on your wife's policy?
Yes.
You're not in.
All right, now what happens if something would happen between now and then? If I'm not on the pool then, let's say after the first year something would happen where I get knocked out, then what happens?
After any incident where your income changes or you're kicked off of, say, your spouse's plan, there's always a grace period that you can, it doesn't matter that the enrollment date has already ended. There's
Okay,
so layoffs, divorce, change of income, death in family.
Yeah.
There are like 5 or 6. Those are 4 of them. But any major cataclysmic thing.
If something happened like that, just get my behind over to you guys and the ball rolling is what you're saying?
Yeah, walk in face first.
Yeah.
So we recognize you, but yeah, bring your behind with you. Don't waste time. Get on in there. Or, call us around the phone. We're actually, when I have this phone number that's called call center, we have 5 people that are going to be working, it's not 24-hour shift. This is not Amazon or Walmart or something, but they're going to be working those hours on the phone. So you can pick up the blower. They will on the phone there. After the first, our navigation team, some of them are going to have portable laptops. So if we were in that situation, if you had another meeting and said, hey, we got a bunch of people coming on, could you get a navigator over here? We'd like to just right there after the meeting, see if we could sign 5 or 10 people up. We'll get a navigator here with a laptop. Boom, we'll sign you up.
Okay.
And if we get Megan, all qualified as a certified navigator, if you go to that clinic for whatever reason, although I know there's some changes she was telling me about, you can sign up with her. We're a full court press. We guaranteed to do $2 million. I see Frank and Cindy frequently over at Fairgrinds. There's a space upstairs called the Common Space. So we use that whenever the groups weren't meeting there. We were there this last weekend because we actually are trying to get to 5 million people. Just went through the list, and every day. Today the Dallas County Schools agreed to take 120,000 leaflets. Lafayette, you got to take 40,000 plus 4,300 workers, something like that?
30,000.
You know, she's a new organizer, so she doesn't know how to inflate the figures yet. We'll wait until she's been at the work for another 5 or 10 years, and then it'll be 100,000 in Lafayette. Boy, Lafayette's looking good. Maybe I can get a gig there. Yes, ma'am.
So, this plan has been passed, the Obamacare has been passed, but not accepted in every state, right?
It has passed. It is the law of our land. There will be an exchange in every state.
Okay, and what's the longevity of this beyond his presidency?
I think somebody said something when we were talking about the expansion of Medicare. Well, once you get on, how do you get people off? I think it'd be very difficult once people find that they have health care. We think people are going to vote with their feet. Once they're on health insurance, they're going to like going and getting checked up every year. They're going to like, you know, being able to go to the doctor when they need to as opposed to not. They're going to like getting drugs when they need to. They're going to like not postponing. You know, I've got somebody who's one of my relatives ended up having to go to the emergency room with emphysema. I mean, for years they couldn't breathe, but they didn't have health insurance. And tell me there's somebody here who doesn't know people who delayed, in some ways critically, their health care because they couldn't afford it and didn't want to be a burden to their family. And if you tell me there's somebody here who wasn't in that situation, I want to shake your hand because you are a rare individual in the United States today. And that's not the case for my members. It's not the case for most people I run into. So yeah, I think it's going to be hard to take it away. And I need to prove it. We need to get everybody on. And then it's even harder. I mean, people start saying, hey, you know, I enrolled. How come I wasn't eligible? I mean, you know, gee, this made a difference. I mean, that shows up in the votes too.
Well, last question. If I'm eligible for Medicaid, if I just don't, who do I sign up with?
When you go to enroll, if it turns out you're eligible, it'll flag right up there and immediately bump you over into the Medicaid system to enroll you automatically.
Wonderful. Thank you.
This is one of those, you know, one-stop things. Now, so far, the website, they're worried that come October 1st, all the websites will crash and everything else, and there's some states that are throwing boulders in the way. In Arkansas, you have to do our certification, then you have to do another certification, and then get a, you know, this and pay this and whatever. But here in Louisiana, at least so far, it looks like it's going to be smooth. You see the numbers, the 800 number, the websites. You know how to find us. Any way we can help. Grab Cindy and Frank if they have me. You can come down to Fairgrounds and catch us, but do this. Was there one more? I thought somebody was just about to say something.
No, I was, but you just.
Okay, and anything we turn out to have said wrong, we'll try to find out immediately. But, the only thing I for sure need to check out is that gross versus adjusted annual income, and I'll make sure that we get that information back here. So call Cindy in a couple of days or call us and just say, okay, no, the answer is actually this, or no, we told you right, it was that. Thank you for letting us be here, and good luck, and let's get healthy. All right. Anytime.